So in this section of discussion, I want to talk about the concept of diagnosis and the way we look at it with Bodytalk. Firstly, diagnosis is probably the foundation stone of most systems of healthcare, whether it be traditional medical or whether it be acupuncture and all the other alternative healthcares. They all rely on diagnosis. They're all deciding what's out of balance, what's going on. And in Bodytalk, we have a problem with the concept of diagnosis. You see, when we look at diagnosis, what are we actually looking at? We're actually looking at accumulating a lot of symptoms and putting together a list of symptoms by examining the person, MRIs, blood tests, and things like that. Then when we get all those symptoms, what we have is a list, and then we're going to match that list to a name. And that name is something we have learned according to the tradition. If we're a Western medical doctor, we've got our list of names, and if we're acupuncturists, we've got another list of names. In traditional medicine, of course, the secret to successful medicine is make sure the name is Latin. And because people are impressed by that, they've got glomerulonephritis or hepatitis and gastritis and so on. And that impresses them. But the reality of the situation is that is not a diagnosis per se. That is a label. That is a label to fit a bunch of symptoms. And that label can be quite abstract because people are so individual. The symptoms never match up perfectly. Never match up perfectly. And the reality of the situation, it may give you a name of a description, but it doesn't tell you why you're sick or what is really going on. You see, telling you you've got stomach ulcers isn't really telling you much. It's telling you, yes, there are stomach ulcers there. And from a traditional point of view, we'll look at the formula, we'll look at something to fix it. We'll try this drug, and if it works, great. If it doesn't, we'll try another drug, or we'll try this herb, or this homeopathic remedy, or this set of acupuncture formula. And if it works, great. If it doesn't work, we'll try another one. And this is the traditional Cartesian approach, because you're just treating the superficial factors. Now, the reality is that if you really want lasting results, because in the case of stomach ulcers, if you use that Cartesian approach, you get rid of the ulcer, but it comes back again. And it's like very often they're told, well, stay on the medication for the rest of your life, because that's the way it is. And whereas in our model, we're saying, no, if we're going to really make fundamental changes, we have to understand why the ulcers are there in the first place. What's their background? What's their etiology? And what you'll find, even in something as simple as a stomach ulcer, there are many different aspects to it. You can have stomach ulcers as a result of your dietary habits, just poor eating, bad eating, eating too fast, things like that. But we also know that stomach ulcers can occur from excess acid, from excess hyperactivity of the vagus nerve, which is worry. And stress, worrying about work, worrying about finances, worrying about your budget, your sick child, things like that, and chronic worry. We also know that stress will do this. And stress can be internal stress, such as biochemical stress, allergies and things like that. It can be external, environmental allergies and stresses, even down to the next door neighbour's barking dog in the middle of the night. And the family and what's going on with the family, or work and the boss or co-workers. We also know there's physical components. If you have a spinal problem in the middle of your back, you can affect the sympathetic or parasympathetic nerve supply to the stomach, which will then upset the balance of the stomach and create an ulcer. Now, I actually could stand here for another 15 minutes telling you various different factors involved in a stomach ulcer. And the key factor is, in reality, you never have one factor alone. It's usually a combination of a lot of those. Part of it's diet, part of it's stress, part of it's worry, part of it's posture problems, part of it's environmental issues. And the key factor here is that until we understand what's going on there and we understand all those factors, we are not truly diagnosing what's going on. And until we address all those factors, we are not going to get lasting or permanent results. We're not actually going to transform the situation. And the reality is that a complete diagnosis, in the sense that I'm talking about here, is virtually impossible by any person. I don't care how much you've studied. I've done Western medical diagnosis, I've done traditional Chinese medicine, naturopathy, homeopathy, chiropractic diagnosis, iris diagnosis, hair diagnosis, aura diagnosis, God knows what diagnosis, okay? And in fact, for many years, I was primarily a diagnostician, and doctors used to send their patients to me for a diagnosis. And I knew very well that I was a lousy diagnostician. I could give labels, no problem. And I could tell people what's wrong. But the fact is, to understand all the other factors that are going on, you had to be psychic. Certainly, I was pretty good sometimes because I did develop my intuition. But I actually had to rely on intuition more than my medical training. And this is a key important factor we're going to come into. Because the reality is that over the years, I realized that the body knew far more than I did. The innate wisdom of the body knew far more than I did. And I realized that if I really wanted to understand what was going on, I was going to have to learn to communicate with that wisdom. Now, I knew this was possible because over a period of time I got in touch with therapies such as applied kinesiology and what we call muscle testing, where we actually found that it was like the body did talk to us, because we could test a muscle, we could put a chemical, say arsenic, near their skin, and the muscle would go weak. And that was biofeedback, saying that when you put that energy field near the body's energy field, and that was dangerous to the body sort of told you that by going weak. And hence you could test allergies that way. And if you put anything that was next to their body that they tested weak to, that was probably something they were allergic to. Okay? And you could also show the stresses. You could talk about their little boy, and their muscles would be fine. Their little girl, their muscle goes weak. Why? You've now learned that the little girl was a trauma to them, some form of emotional stress to them, which you were able to find out by actually asking their body, not asking them, because they'd say, oh, no, I'm just as happy with my little daughter as I am with my little boy, when in fact they weren't. So I used that principle, but of course we were able to take it a lot further than that, because neuromuscular biofeedback has its place. It's used in applied kinesiology. I used to teach applied kinesiology. And it's a great system, but it's not good enough for what we need to do in Bodytalk. And so we're going to discuss that further and what we do with Bodytalk in the next section.